Torres here, host of Entertainment Weekly. Today we have a surprise for you. We have the creators of PharmPhix, new TV show, and we have the creators Ryan O'Connor, TJ Kelly, and Dan Gonzalez. So you guys are in for a surprise. So Ryan, would you mind telling us what exactly the premise of the show is?
Yeah. So on PharmPhix, the show that we've just created, it's about how the nation in 2050, how the medical society has come so far from the past, and how we use so many different pharmaceuticals and new forms of medicine to help cure sick people. But along with all the benefits of these new medicines, everything, there's also a lot of problems because we haven't been able to test it out fully. So I don't know yet for sure how the whole season's going to go, because we have to show that there are significant benefits and people are being saved with all these medicines. But at the same time, the pharmaceutical companies have gone too much into the legislation of the country and are changing too many laws in their favor to be able to put out any drugs they want. So it's a very in-depth show that really goes into the times and problems that we have as a country right now.
Sounds very interesting, Ryan. But I'd like to know how exactly you guys came up with the idea of this PharmPhix. TJ, would you like to explain?
Yes. So basically, we all wanted to make a show that kind of, encompassed the whole medicinal industry, and we just wanted to make something realistic and something eye-opening to the general public. We just wanted to spread light on the epidemic because not a lot of people are aware of what's going on and how they're being taken advantage of.
Well said, TJ. Now Dan, I'd like to hear what you have to say.
Well, in contrast to TJ's negative views, there is a bright side to these new pharmaceuticals. My aunt is a prime example of this. She was diagnosed with pancreatic cancer about 3 months ago, and if this was 200 years ago, she would have been dead. It would have been a death sentence for her. And if it was 40 to 50 years ago, she would have to undergo chemotherapy. And even if she lived through chemotherapy, it would have been a lot of bills and treatment, or painful treatment. But now with today's modern age in pharmaceuticals, she takes this pill called Amjeta, and she takes it 2 times a day, and in 6 weeks, she's been cured of her pancreatic cancer. Although TJ has been saying that there are many negatives to the modern medical and pharmaceutical industry, there are also many benefits. For example, just like my aunt's story. In the making of this series, I didn't want stories like hers to be untold.
So, Dr. O'Connor, after developing your drug Amjeta, can you tell me how many patients have been cured?
Yes, as a matter of fact, Ed, my drug Amjeta has helped many people. After a few years of research and development, we found out that after synthesizing the right chemical compounds, Amjeta proved to be the perfect medicine in the fight against cancer. And there used to be so many different methods and trials and tribulations. People tried for years to fight this infectious disease that would just, sweep across nations. But finally, I can say that my team and I have come up with something that has truly, so far, proven to be effective. I can think of a few stories off the top of my head where, there was mothers of families and social workers. There's been great people. There was I believe he was president of Uruguay. He was cured by my drug. And it feels great to know that I can be saving such great people. The common housewife to anyone, they're all being saved by this. So it's truly a great thing. If I had to put a number on it, I would say probably nearly 1.7 million people have been cured in the last 2 years from this.
That's great to hear, Dr. O'Connor. Dr. O'Connor.
Dr. O'Connor, we have an emergency room 666, floor G. Patient needs help ASAP.
Nurse?
Yes, Dr. O'Connor?
Alright, he should be okay. I I can't believe we let him miss a dose of Amjetta. In order to compensate for the missed dosage, we're going to need to have 4 shots today, 1 at each 6-hour interval. Okay?
Okay.
Start with the first one in the neck intravenously.
Okay.
This is a shame. You know, this shows the nation's dependency. It shows how we've come to a point where we can't go a few hours without some sort of medicine. We've become literally dependent to the point where, as a whole, everybody needs something. We all need something, whether it's, medicine in the morning for your blood pressure, or it's as serious as cancer. We cannot thrive. We can't even exist for a day without it. And as a doctor, as the creator of this, it works to my benefit. I mean, it's my entire life. I would have no money, no career without it. But at some point, there has to be parity. We must stop this nonsense. Good, good. You can bring in the next needle. He needs some more. But seriously, I just can't believe that it's come to this point in a nation where we're so dependent. There needs to be more reform in the legislation because this is freakish. Welcome to my office, Mr. Brown.
Thank you. I would just like to know how the government feels about your new drug.
The new drug Amjetta?
Yeah.
Well, as a matter of fact, the government is actually very, very glad to have Amjetta as a new drug on our market. But that honestly goes without saying, because my personal opinion, and as is the opinion of many other people who are aware of the social problems that we have today, is that the government is much too accepting of all new drugs on the market. The problem is that Big Pharma and all these other top pharmaceutical companies are lobbying with the government so that they can pass pretty much any drug that they want. They've been, paying off, people here and there, hiring spin doctors, putting out studies that say that, their drug is safe, this and that, just so that they can turn a profit. It's honestly sickening. Although there are great benefits, for example, my drug, which I've seen, I told you, save over 1.7 million people's lives, it's also sickening when you see the negative side effects of, other drugs, like some painkillers and stuff that, are basically like the pharmaceutical companies turning into legal drug dealers. They're using the legitimate, doctors as an outlet to sell their pharmaceuticals and turn a profit, when they're not taking at all their clients' health concerns into care. So, who's there? You can come in.
Dr. O'Connor.
Hi, how are you? You appear familiar. I can't put a name to your face, though.
Yeah, I'm
Mr. O'Connor. Dr. O'Connor.
Oh, I'm Mr. Gonzalez.
Mr. Gonzalez, hi.
I'm Lucy's grandson.
Lucy's grandson.
Lucy.
Oh, were you in room F66 yesterday?
Yes, I was. That was me, so.
Oh, you're my Amjetta patient. How's your condition going?
Oh,
it's been a few weeks since I've seen you.
Yeah, she's great. I just wanted to say thank you so much for everything, and without your help, we would have pretty much have lost her, and you saved us a lot of grief and stress. Just wanted to say thank you.
You know what? Thank you, Mr. Gonzalez. It's people like you coming in each and every day that make what I do worth doing it. Without people like you, when I go home, this is the stuff that I would never lose sleep over. It gives me that drive every day. People like you, man. I wanted to really say thank you. I appreciate you coming here. It makes all my hard work, and let me tell you, it was some hard work in the research and development of that drug. But thank you. I'm glad that your family's okay. I'm glad to hear you and Lucy are doing okay. And if you have any other problems, with side effects or any aftercare, come to me. I'll point you in the right direction, and I know some people here around the hospital, friends and family members and the staff that can help you out. So thank you again, Mr. Gonzalez. Have a good day. And tell Lucy I say hi.
All right. Thank you very much.
No problem.
It was a very touching clip. I'm glad everyone at home saw that. Is there anything else you guys want to say about the show?
Well, it premieres in a month, April 14th. I believe it's a Thursday at midnight.
2051, April 14th.
2051, April 14th.
Mark the date.
Mark the date on your calendars because it's going to be a great flick, and I hope all of you enjoy it. Not much else to say. It's going to be a great show.
Thank you. We're glad we could show the public, give you guys a little taste about what PharmPhix is going to be about. It's going to be on MED TV, MED TV. For those of you who have IO, that's channel 143. For those of you who have DirecTV, it's 207. And I just want to say thanks again from the creators here, Ryan,
Dan.
Thank
you very much.
Enjoy. You overdosed on Amjetta.
Alright, ready? Oh wait, it was...
Thank you guys for coming on the show tonight. For NBC, this is Edward Torres. Have a great night.